Good afternoon, gentlemen of the press. We called you to read and explain the communique issued at the end of the National Executive Council meeting of the Nigerian Medical Association that was held at Oka, Anambra State between the 8th and 12th of December 2020. You are welcome. The National Executive Council meeting of the Nigerian Medical Association held at Oma Event Center, Oka in Anambra State, between 2029, had a theme which is medical doctors, politics, and leadership in the society. And the sub-theme, which you will expect, is managing mental health in COVID-depressed economy. We'll see that these are very topical issues, particularly the issue of mental health and COVID-19. The meeting before it started had courtesy visits, as we do normally, to the traditional institutions, governments, and other stakeholders. And in this case, we paid a courtesy visit on the Vice Chancellor of Nnamdi Azikiwe University, Oka, Professor Charles Esimoni, also the Chief Medical Director of Chukwuemeka Meko Teaching Hospital, Oka Basi Nwankwo, the Obi of Onitsha, His Royal Highness Igwe Nnameka Achebe, CFR MNI, and other distinguished personalities in Anambra State. Contemporary issues affecting the healthcare delivery in Nigeria and the response to COVID pandemic, governance and welfare of members of Nigerian Medical Association were thoroughly and seriously deliberated upon. There was a session on continuing medical education because we as doctors, we will continue to educate ourselves and improve on our knowledge and experience in medical practice. And there were tour of facilities. The opening ceremony was declared open by His Excellency, the Governor of Anambra State, Chief Willie Obiano, who was ably represented by the Deputy Governor. And the meeting was graced with, by important personalities in the state, including but not limited to those that I have mentioned above. Now, at the meeting, we made the following observations. One, we note that the commencement of the second wave of COVID-19 pandemic amidst the flagrant disregard for the non-pharmaceutical prevention protocol and waning efforts at the containment of the scourge, while further noting the current concern for vaccine access internationally, whereas such serious conversations have not yet started in Nigeria. We bemoan the incessant spate of emigration of highly qualified medical doctors and other healthcare professionals to greener pasture, what we call the brain drain, at a time when their services are critically needed in Nigeria. And observing further that efforts at engaging these nationals have not yielded the expected result. That means we have to change our strategy. We also deeply are worried that some Nigerians in privileged positions still embark on foreign medical treatment for conditions that could easily be managed and treated in the country, thereby reducing the opportunity for revamping the nation's health sector and improving the service delivery through their patronage of local health facilities. We note the progress report on the welfare of our members in the civil service of Abia, Imo, Anambra, Ekiti, and Kogi states. And we appreciate with heightened expectation the commencement of the implementation of the promise made by the Abia State Governor. And we want to use this occasion to be appreciative to him because 2 weeks ago we visited him, discussed with him, and he promised that was going to start implementation. And in fact, he has commenced implementation. In addition to ensuring that the access to the health facility at the Abia State University Teaching Hospital, the construction work has commenced. And I think this is a positive development, and the fact that our advocacy is working. We note that the backlog of we further note that some level of progress has been made in Kogi and Ekiti State, while no significant engagement has been made in Anambra and Imo states. We expect that the state governments that have been mentioned should rise up to the occasion so that our doctors can provide committed service to the people of Nigeria. And one way of doing that is to ensure that they pay their salaries regularly. We deliberated on a report of the NEC instituted committee to supervise to take over the functions and activities of Enugu State NMA, which which election was disrupted, and we are happy to say that the committee worked assiduously, following the provision of the Constitution, in ensuring that the process went very, very smoothly. We note the recent High Court judgment in the case between Frederick Akwadigwe versus the Nigerian Medical Association and Medical and Dental Council of Nigeria on the compulsory NMA building levy, which has been appealed with stay of execution. We appreciate the commencement of the amendment process of the Medical and Dental Practitioners Act, which has passed the second reading at the Senate, and the review of the Medical Code of Ethics with the overall aim of enhancing ethics and professionalism in conformity with contemporary expectations and practice. It is saddened by the mounting difficulties faced by members, especially the private sector organizations, in assessing the central bank's 100 billion naira intervention fund, contrary to expectations. Identified with the ongoing 16 days of advocacy against gender-based violence, and facilitates with the affiliate body, the Medical Women Association of Nigeria, in her advocacy for women and girl child empowerment initiative, while congratulating the president of NMA on his decoration as the 11th M1 male champion during the meeting. We also are deeply worried over the worsening state of insecurity manifested by insurgency, armed banditry, kidnapping, and the recent 133 young children from school that were actually abducted from school in Katsina State. We are very, very worried. It's a replica of the Chibok abduction, which we are still regretting. We also regret that medical and health workers are not, are being kidnapped at will, and we think that they should be properly protected because they appear to be targets. We don't know why, because doctors are suffering. The other health workers are not suffering, and we know clearly that we do not have the fund to pay ransom. So we need security for them to work maximally. Following our observations, the following resolutions were made. 1, that serious efforts to prioritize health, including supplementary appropriation and budgetary provision, should be initiated by governments at all levels and the private sector coalition to ensure the procurement and availability of consumables for effective response in the containment of COVID-19, especially with this upsurge of the infection, now we call the second wave. We also wish to advise government to procure the vaccines that have been reported to be effective for further research study on Nigerians to confirm their efficacy and safety for Nigerian public before we can use them. A passionate appeal to all Nigerians to take the COVID-19 prevention advisories very seriously in order to interrupt the transmission and reduce the ill health and deaths from the dreaded virus, COVID-19. The strict adherence to the NCDC protocol of the use of face masks, regular hand washing, and use of sanitizers, and social as well as physical distancing is very strongly advocated. And we think we say very clearly that Nigerians should comply with the advice of experts. In non-essential travels should not be embarked upon, especially during the Yuletide seasons and beyond. We don't believe that if you have no reason to travel, please stay at home, because we want to interrupt the transmission of COVID-19. More deliberate and strategic efforts must be made by governments to ensure the return home of our Nigerian doctors and other healthcare professionals in diaspora to contribute their quota to the improvement of health and healthcare delivery services, as well as national growth and development. Now, we also noted, we state very clearly that prevalent Nigerians should demonstrate open confidence in the nation's healthcare delivery system, as well as patriotism by patronizing services, as well as call for the establishment of National Health Bank in order to fast-track the infrastructure, procurement of the state-of-the-art equipment, which will help to provide world-class healthcare for Nigerians in order to reverse medical tourism. A ratification of the report of the Caretaker Committee, recognition and admittance of the newly elected officers officers committee led by Dr. J.O.T. Onya, and warned that the show of shame exhibited during the botched election should never be repeated in future. In the same vein, the disciplinary committee of the Nigerian Medical Association will commence work to hear all cases referred to it following the botched election in Enugu State. Anyone found guilty in the August 2020 election crisis in Enugu will be punished in accordance with the provision of the Constitution. We believe that diligent prosecution of the appeal case, which NMA and co-respondents instituted, and directs that the payment of the building levy remains a requisite for the renewal of 2021 annual practicing license. And to educate and mobilize extensively all members and other stakeholders to support and actualize the amendment of the Medical and Dental Practitioner Act. We call upon His Excellency President Muhammad Buhari, GCFR, political leaders, strategic stakeholders in the nation's financial sector, and the entire citizens to prevail upon the Central Bank of Nigeria to soften and modify the constitutionalities for assessing the health intervention loan, especially given the current state of the nation's health care as exposed by COVID-19 pandemic. The adoption of the Medical Women Associations of Nigeria male involvement in maternal and child care advocacy document and strategizing for their implementation nationwide. They continue to strategically engage appropriate quarters in order to achieve the implementation of the extension of the retirement age of medical and dental practitioners in Nigeria to 65 years, and special pension benefits as contained in Circular 1 of 1991, restoration of the MSS, that's the medical salary scale, system scale, implementation of the commerce for medically qualified lecturers, and its universal applicability for doctors in employment of the states and local government councils. Also call on the federal government to commence negotiation with NMA on the 2019 Collective Bargaining Agreement, CBA. Also to intensify the call on the federal government and its security agencies to assess and evaluate the current strategies on the security situation in Nigeria and commit to more effective reforms in order to secure Nigerians wherever they may be in the country. Gentlemen of the press, the annual delegate conference, the CMA decided, the NEC decided and approved the fact that the next year annual general conference will hold in Jos, Plateau State, between 26th of April to 1st of May, and we expect that it is going to be won among equals. We appreciate the participation of all the others, the hospitality of Anambra State, government and doctors, and we must say that we were properly treated. Now, the Council continues to appreciate the immense patriotic commitment of our members in the public and private sectors nationwide on the national response for the containment of the pandemic, the COVID-19, as the nation has started to witness the second wave of the pandemic, which appears to be more deadly. This is despite the daunting challenges in the operational environment in the health sector. The NMA, as a custodian of the people's health, must give leadership in order to ensure that the health of Nigerians is of topmost priority, while not forgetting the welfare of our members. Finally, the Nigerian Medical Association wishes Mr. President Muhammad Buhari, GCFR, and all other Nigerians, including the press, Merry Christmas and more prosperous and healthier New Year 2021 in advance. We advise that we stay safe by following the NCDC protocol for the containment of COVID-19. Thank you very much.
Thank you very much.